Hi friends, once again welcome back to my channel. Today we are discussing Rhinosporidiosis. Rhinosporidiosis, it is a subcutaneous fungal infection and it is a chronic condition and is a granulomatous disease seen in both human beings and animals. It is mainly characterized by a polypoid outgrowth of nasal cavity, conjunctiva and other body sites. And the causative agent it is Rhinosporidium seeberi and it was first reported in a 19-year-old agriculture worker by Sieber. Coming to the stages in life cycle, we can see three principal stages. They are maturation of trophozoite, development of sporangia, production of endospores. The vegetative state is trophozoite. After that, the sporangia it is formed, and within the sporangium we can see endospores. And the matured endospores they are released through minute pores in sporangium or by the rupturing of sporangium. This is the life cycle, that is the trophozoite, it forms intermediate sporangia, then the complete sporangium it is formed liberating the endospores to the atmosphere and these endospores they repeat the life cycle. Then coming to the epidemiology, the high incidence it is seen in people who are frequently bathing along with domestic animals in ponds, tanks and lakes. This is because the reservoir is fresh or stagnant water and the organism is hydrophilic in nature and disease is mainly seen in rural areas and the predominant category is male. This is because of their outdoor activity. The male-female ratio it is 3:1 to 4:1 and mainly prevalent in poor people and there is no barrier for any race. Then coming to the pathogenesis, these endospores which are liberated into the atmosphere or the environment, they get lodged in the host tissue and there they mature into endosporulating sporangia and thus they repeat the life cycle inside the host. Then clinical features, incubation period is 1 to 10 months and the clinical presentation it is different in different people or this is mainly depending upon the affected site, size and extent of lesions. Then infect mainly the mucosal surface layers and polypoid outgrowth or polypoid growth it is the main feature and it is mainly seen in nasal cavity. This is because nasal cavity it is the most common site affected. Then coming to the clinical manifestations, the clinical symptom or the clinical appearance it is known as rhinosporidiosis and we can see four types of rhinosporidiosis: nasal, ocular, cutaneous and miscellaneous type. First we can see nasal type. The commonest site affected is nasal cavity. So the polypoid lesions they will be seen in the nasal cavity and they are vascular polypoid lesions so they bleed easily. And the lesions they are having a characteristic appearance, that is they may be looking like a strawberry or a cauliflower. Then sporangia they appear as tiny whitish spots under the epithelium. So these whitish spots they can be easily demonstrated and the sporangia so it is a diagnostic feature. Then the nasal discharge with blood stain can also be seen. Then other symptoms are unilateral nasal obstruction, thin mucoid nasal discharge and there will be no pain, itching in some cases reported. Then ocular rhinosporidiosis. Eye it is the second most commonest site and another term is oculosporidiosis and here we can see monocular type. The conjunctiva it is usually affected. Here also we can see the formation of polyp. The fleshy polyp it is having greyish to white granular spots which are scattered over the surface. Spots represents the superficial sporangia. Here also the lesions they produce a blood stained discharge and sometimes the lesions they will be very large so that they can obstruct the blinking of eyelids. Here conjunctiva it is exposed and is mainly affected and the lacrimal glands are also affected. Third one is cutaneous rhinosporidiosis. It is very rare. It is somewhat wart-like. Then papillomatous sessile masses can be seen and these masses they are formed in areas adjoining to nose and face. And here also we can see subcutaneous scattered nodules and they sometimes ulcerate over the skin. Then the mode of infection, it is either direct or hematogenous spread, and if it is through blood, the spread results in painless firm to hard subcutaneous nodules, and these nodules they remain unattached to the skin. Then last one is the miscellaneous type. Here we can see papillomatous lesions. Lesions are mainly appearing on buccal cavity, vagina, vulva, penis, urethra or rectum, and the lesions can also be seen larynx, scalp, lips, palate, etc. Here the main reason is taking bath in contaminated ponds. And some patients they have bone involvement also, that is bone lesions are also noticed in some patients. Here we can see extensive bone destruction in such cases. Then lab diagnosis. Lab diagnosis, it is mainly done with the help of clinical manifestations and also the appearance of lesions, then the geographical residence of patient and also the history, if there is any local recurrence, and the demonstration of the organism in affected tissues. And the demonstration of organism in affected tissue, it is mainly done by direct examination. Other methods are culture, immunodiagnosis and animal pathogenicity. First we will see direct examination. Direct examination, it mainly depends on direct microscopy. This is by histopathological examination. Here scribe cytology and fine needle aspiration cytology, that is FNAC, they can be used. The biopsy of the lesions or nasal washing, it can be examined in KOH mount, that is 10% KOH solution can be used, or hematoxylin eosin staining can also be adopted, and this method shows giant cells. May-Grunwald Giemsa stain, it is used to see dark blue thick chitinous walls of the sporangium, and the cytological techniques, they are very useful in quick diagnosis of Rhinosporidiosis. Then in stained sections we can see sporangia, sporangiospores, connective tissue, epidermis, etc. Sporangium with sporangiospores, they are clearly seen. Connective tissues, we can see they will be edematous in nature. Epidermis, it will be appearing hyperplastic, and in sections we can see the wall of the mature sporangium, it is showing two distinct layers. That is, we can see two layers in sporangium, the inner cellulose layer and outer chitinous layer. Then coming to the culture method, there is no successful method for culturing this Rhinosporidium. That is, there is no successful artificial culture media. They can be grown in vivo in epithelial carcinoma cell lines, but there is no permanent cultivation method. Percol is a sterile preparation of silica, and it can be used for isolating spores, and later it has been successfully isolated, that is Rhinosporidium has been successfully isolated in vitro at Kerala University. Then coming to immunodiagnosis, the many methods, immunological techniques such as counter immunoelectrophoresis, immunodiffusion, dot ELISA, all these are there, but all these techniques, they do not demonstrate the antibodies in serum. So there is no effective diagnostic method or serological method for the diagnosis of Rhinosporidium, and there is no skin test. Then coming to animal pathogenicity, inoculation in these experimental animals is also not successful because there is no animal models for this Rhinosporidium. Then that's all about the lab diagnosis. So the effective method for diagnosis, it is microscopy. Then treatment and prophylaxis. It can be treated by surgical removal of polyp. That is, in some cases we have to remove the polyp. That is, it is done by the excision of the base of the polyp. And in here we can also give pentavalent antimony compounds as intravenously, that is intravenous administration of these pentavalent antimony compounds like neostibacin can be done. And as mode of infection, we can see the infection mode, that is SHS and hydrophilic organism. The reservoir, it is stagnant water, so the organism can be seen mostly in aquatic conditions. So the effective prophylactic measure is that to avoid contaminated water, exposure to contaminated water should be avoided so that we can avoid the infection, and there is no any other prophylactic measures, and there is no vaccine available. That's all about treatment and prophylaxis. And that's all about Rhinosporidium or Rhinosporidiosis. Hope you all understand the session. Thank you. Have a nice day.